After answering the 10 questions to the assessment activity 13-3 to diagnose the probability of having diabetes or if at risk of diabetes, none of the answers resulted in a response of having diabetes. There is no history of diabetes in the family bloodlines, and there is no numerous factors that may have prevented this from occurring in the family bloodlines by healthy insulin secretion, normal glucose tolerance, eating wholesome foods with natural fiber rather than processed foods, and exercising regularly through labor and physical activity. Tiring quickly or always experiencing fatigue is something many people can develop over time depending on their work, college, physical exercise, and family schedules. Even though there is no signs of this personally, it is a good rule to ask a physician about the variations of glucose levels in blood. According to the Diabetes Company of the United Kingdom, tiredness is a result of having an imbalance between one's level of blood glucose and the circulation of insulin through the body and can happen immediately after eating a meal, fatigue with a short workout, and irregular patterns in coordination with medications. The other factors related to diabetic assessment are frequent urination, which is negative. Consistently thirsty is negative. Vision does not blur. No sudden loss of weight. Weight is kept in control. And there is no feelings to overeat. Wounds have not happened recently, but the wounds clot quickly to promote healing, and skin does not feel itchy without reasons, due to exposure of dust at the work site or recreational activities. Though there is no personal sign of diabetes while eating right and keeping extremely active between work and physical exercise, one may never know when carbohydrate or glucose levels result in irregular insulin processing and can be assessed during semi-annual, annual, and immediate medical intervals. It must be a continual factor that any change in physical wellness, sleep habits, vision, urination intervals, and weight management can be a risk that, once identified, should be taken care of with medical attention to prevent any further damage to the human body. Diabetes mellitus is a group of diseases resulting from situations of the human body not producing enough insulin, using improper amounts of insulin, or not producing any insulin at all. An individual with diabetes may experience emotional withdrawals, have physical wellness issues, and have circumstances dealing with their problems spiritually. Emotions are the first thing that a person with a lifelong self-management and diet, forming a physical exercise plan, taking medication, having to continually monitor blood glucose, and the guilt that built up from dieting choices. These attributes can make a person feel emotionally drained and will need understanding friends and family to help discourage negativity and re-engage positive, healthy choices. Some of these healthy choices are with physical wellness. For a person to be healthy inside and out, or to work towards bettering health after an identifiable cause, physical wellness can help a person change specific lifestyles and take action to feel good and reduce the fatigue and disruptions associated with diabetes. According to the Biomedical Corporation of Public Health, physical wellness is influenced on the social, demographic, clinical, and health behavioral characteristics of an individual, which describes their sex, age, ethnicity, socioeconomic duties at work, waist circumference, smoking status, alcohol consumption, dietary intake preferences, and well-being. The best way to help a person with their physical wellness is introduce the intention and work with them to help them change and work toward bettering their health with social wellness, integrating positive communication to help them improve their physical wellness. Social wellness not only improves a person's physical wellness to thrive for themselves to move through diabetes, but also increases their chances to reconnect spiritually and regain emotional focus with spiritual wellness. When an individual develops diabetes, they may blame themselves for their dietary purposes, sedentary lifestyles, or hereditary disadvantages, and this declines the spirit they once had. But with the social wellness and emotional wellness of others who want to help out, such as practitioners, doctors, friends, and family, can help improve a person's spiritual wellness and rebuild the foundation for their purposes. Spiritual wellness expresses deep inner faith and reliance on beliefs and practices to break through challenges to regain strength while facing the fight against diabetes by protecting the body about what is put into it and thriving self-confidence by glorifying God in the body and nourish the spirit. With the encouragement of spiritual wellness, diabetes will be easier to deal with and regain an ultimate purpose to move on with a good life and eating what is right with natural foods rather than prepackaged or processed foods. 3 lifestyle habits to continually practice to reduce the risk of catching diabetes type 2 or type 2 diabetes are diet, exercise, and weight management. Diet is important because most people opt for the convenience of fast foods, processed foods, and simple carbohydrate foods. Having a good diet means to eat the right kinds of foods, such as fresh vegetables, fruits, beans, and whole grains. Reducing the portion of certain food choices and refined ingredients can definitely cut down the chances of catching diabetes. According to Fred Cheriton, author of the proven United States National Library of Medicine topic titled Exercise and Diet Reduces Risk of Diabetes, states, when people make intensive lifestyle changes by exercising 30 to 90 minutes or more of physical activity, such as walking or working out every day, can lose 5 to 7% of their body weight from 3 to 6 months out, depending on workout routines, and can prevent the risk of getting diabetes by 31%. When a person exercises, it reduces inflammation on the joints, provides restful sleep, helps prevent heart disease, helps a person breathe easier, reduces fatigue, and eventually helps a person build more endurance and self-confidence. Weight management combines the need for diet and exercise. When a person is overweight, it raises the risk for developing diabetes, illnesses, and disease. Taking a good look at oneself and taking a step forward toward reducing the size of the waist reduces the size of diabetes by cutting fats from foods such as meats and dairy products. Eat fresh vegetables and fruits and eat smaller portions of foods throughout the day. When you practice a good exercise routine and stay committed to going to the gym while being physically active, it can result in feeling energetic, improved lung function, peaceful resting without insomnia, reduces the risk of myocardial infarction, and saves money from serious medical bills concerning diabetes.